Good morning. My name is Sudesh Sivarasu. I'm from University of Cape Town in South Africa, and I'm here to introduce CerviScreen, a speculum-free digital cervical cancer screening device, specially designed for low resource settings. Before we get into the innovation, let's talk about the problem that we are trying to solve. Cervical cancer is the fourth most common cancer among women globally, affecting over 600,000 women each year. Yet, what's most alarming is that 85% of these cases and 90% of deaths related to this occur in low and middle income countries. Why is this case? Because screening, our best tool for early detection, is not reaching the women who need it the most. Traditionally, screening relies on expensive infrastructure, trained personnel, and invasive tools like the speculum. This not only limits access but also deters women from getting screened due to discomfort and fear. In these settings, a missed screening isn't just a statistics. It's a mother, a sister, a daughter whose life could have been saved. One of the biggest fear that we have noticed, and there is a study around this, is for women who are not willing to go for cervical screening, is not the screening procedure per se. It's more the fear of the speculum. And one major observation that we have noticed in our clinics is that the cold metallic feeling of a speculum is the most challenging fear that a woman has when they go into cervical screening. So, what have we done? We have developed a low cost handheld digital screening device that completely removes the need for a speculum. It offers real time video imaging, built in illumination, and acetic acid application, all integrated into a compact ergonomic form factor suited for frontline clinics and mobile screening programs. It is not just a redesign, it's a reimagination of how screening could be accessible, comfortable, and dignified. So essentially, what we have done, we have taken what could be a usable system into something that can be appropriate in the environment where this could be used. So from an engineering innovation point of view, what have we done? It's built around user-centric design for low and middle income countries. A CMOS camera and with a green-white filter for clear visualization, a compact spray mechanism that allows you to squirt the acetic acid as and when needed, and the aceto whitening per action can be performed. A collapsible silicone cube that gently dilates without pain, a digital a single-use cover for hygienic and rapid deployment, and more importantly, a battery air powered and portable design to go and use wherever it is needed and wherever the need is the highest. So we have went ahead and validated this service screen device based on ISO 8600, and we are very happy to say that we have passed 6 out of 8 performance tests, including the field of view, the resolution, the safety, and usability. It is also tested on the Zoe pelvic models with a relatively higher usability score of over 68%, indicating that it requires very minimal training for healthcare workers. This is key because many settings, the frontline workers are nurses and not necessarily GPs or specialists. Empowering them in such a tool will change the game how cervical cancer screening is currently done. And as you can see, the testing results are fairly overwhelmingly positive. So what we offer, we see that ServiScreen could potentially offer a fourfold impact. We see that the screening uptake could increase significantly because the procedure is less intimidating and more acceptable. The comfort is prioritized. The fear of the cold metallic speculum is reduced, and the solution is ready for telemedicine usage. So potentially one could actually build on with our existing system to go into using AI for diagnostics. And it's also a wonderful system that allows screen and treat workflows, which where in many areas where we don't get the patients to return and do follow-ups, this could be one simpler way that the workflow could be completed. So our vision is to cut cervical cancer mortality in LMICs by 50%, as targeted by WHO. This innovation needs a pathway that we're creating for impact. We are preparing for clinical trials on human subjects, refining the illumination and probe size, and actively seeking funding partners to commercialize this innovation and to scale this innovation and not only regionally but possibly globally. So let's not allow geography or income to determine a women's faith. Let's build technologies that treat dignity as a design input. Let's innovate for equity in women's health. Thank you.